Lincoln Surgical Associates combines both recently trained and experienced surgeons to form an exceptional team. Each surgeon has extensive knowledge of the latest surgical advancements. To provide the best care possible, we take a multidisciplinary approach to treat every patient we see. At Lincoln Surgical, we offer the latest in routine to advanced surgical procedures for patients in the greater St. Louis area.
I've had the good fortune of being in this group for many years, and I started my practice here, and it's in full form, if you will. It has been very satisfying to not only be able to help build a group, but be part of it. And we've had our great moments, our successes, and we've had our times that have been very difficult. But we have found that when we have those difficult times of a patient complication or an issue that comes up, that's when we find out that we're really the doctors of Lincoln Surgical, because it's how you take care of those problems that really has defined this group. Because those things are going to happen, and that's when I think physicians find out if they're really doctors, is when they take care of those problems when they arise. I don't think I could find a finer group of people to have worked with in these years, a more professional group, that any of them could operate on me and my family at any time. I would be very comfortable with that.
In general surgery, it's a little bit of a misnomer, and it's confusing to most people, quite honestly, what we actually do. We're boarded in a number of areas of subspecialty to the human body, and that is the endocrine system, the abdominal wall, and any of the GI tract, basically from the esophagus to the anus, we're boarded to take care of and do on a regular basis. Included in taking care of some of those things is the area of minimally invasive surgery and now robotic surgery, which are both interests of mine. Minimally invasive surgery has always been appealing to me. I'm mechanical, and they allow us to use some of the latest instruments and get involved in some of the cutting edge stuff that's always been quite interesting to me in surgery.
I see new patients that are referred to us in the office have abnormal mammograms and ultrasounds, and we set them up and perform their biopsies, and I will see follow-up patients in the office. I'll have 2 days or 3 days of surgery where we're actually performing breast cancer surgery or other types of biopsies, and we'll follow up with those patients. And several days a week I'll actually sit in my office with patients and their families and discuss their new diagnosis of breast cancer. It's a very packed week because of the nature of the practice. When women have abnormal mammograms and breast health issues, they're very important, and they need to be dealt with quickly for lots of reasons. And so we don't really have idle hours where we're waiting for something to happen because people want to get in to use those spots. So we're always seeing somebody or taking care of somebody, usually most of the day long.
Lincoln Surgical, in my mind, is a special group in that its reputation precedes it. I knew from the moment I was taken around the hospitals by Jay Haynes when I first interviewed with the group that this was something special, and the more I've been here, the more I realize that it's about doing things the right way, putting people first. That's something that has been appealing to me since the beginning, and fortunately, even though we've grown, hasn't changed.
Visit each surgeon's webpage to watch a video and learn more about them.